Welcome to Vistac's Health and Wellness Show. Today we feature ReGen Rehab Hospital, which specializes in medical rehabilitation. Our guest today is its CEO, Sue Lee. Sue, welcome to the show.
Thank you. Thanks for inviting me, Brian.
Now, Sue, give us an overview of the hospital and what your focus areas are.
Sure. ReGen Rehab Hospital is a specialist hospital focuses on rehabilitation medicine, which I call it in short rehab. Otherwise, it's a mouthful. And
Yes.
we are a first private rehab hospital in Malaysia, providing inpatient and outpatient post-acute rehab services. When people ask, what do you mean by post-acute hospital services? It's patient who suffers urgent treatment at the acute hospital,
Mhm.
and after they are stabilized, they then come over. For example, someone who had a stroke, or their blood pressure and whatever condition are not stabilized when they are admitted at the acute hospital. And once everything gets sorted out, maybe in between 5 to 7 days, doctors felt that they are fit for discharge. Physiologically they are well, but functionally they still need a lot of help. You know that as a patient suffer from stroke, they will have functional deficit, like perhaps not able to swallow properly, not able
Mhm.
to speak properly. They have speech incoherence in their speech and their movement, the hands and the legs. So all this need a lot of support. So though they are physiologically well, they still need to be functionally well. I think in medicine, uh, Malaysia is very good with right now taking care of all the primary care, secondary care, and even tertiary care services. I think the government and the private hospital have done fantastic job in providing such healthcare needs to our patient. But right now we are talking about ReGen Rehab offering post-acute rehabilitation. That means even a patient is physiologically well, functionally they still need help. So for a patient who have suffered from a stroke, it can be, the stay at ReGen is minimum 2 weeks to even a month. And during that golden period where a patient who have lost those function, and when they go through intense rehabilitation, they can then restore back those function they have lost during the stroke attack. So that's what we do, and that's what we are focusing on, achieving their recovery goals and their functional goal. So at the end of the day, we want to be able to improve a patient's quality of life, both functional, which is physical part, and also cognitive, that means the mental part. So our rehab very structured. Our rehab program is very structured, where we offer different types of therapy and rehab nursing. And of course, all these are being managed by our rehab physician.
Now, Sue, it extends also beyond people who have suffered for things like stroke. It's also sports injuries, which is
Correct.
something which is very, very in demand right now because people live a lot of active lives. I myself have used rehabilitative services in the last 2 years recovering from a sports injury. So I understand the value of it. So one of the key differentiators for you is the fact that you have a dedicated facility. It's a 96-bed hospital facility, I understand.
That's
And
right.
so it's a one-stop shop in that case.
Yes, yes, you are absolutely right. Why I talk so much about the stroke patient is because that's our star product, a stroke rehab, or we classify under neuro rehab. That is our star product. Two-thirds of our patients are stroke-related patients, and those need inpatient stay. For a sports rehab, someone who sustains a sports injury, they may not necessary to stay in-house, but they will be treated as an outpatient, going through very intense rehabilitation after their surgery, making sure they follow through and then condition back their muscles and whatever area that they have hurt, and restore it back to its original function, the range of motion where they can move, especially a tennis player or a badminton player where they need to have very intense rehabilitation. So yeah, we do see many athletes that come to us.
So one of the key challenges with having a facility like yourself for rehabilitation is the cost implications. Since you probably, in your context, have a very multidisciplinary approach to rehabilitation. How do you manage this? Because some of this, obviously, even for a stroke patient, it may be cost prohibitive to be inpatient patient over a longer term period. And an outpatient approach may be the one that's more affordable to the patient. How do you balance this with regard to the patient's welfare versus the cost of it?
Yeah. Because we understand that cost could be a factor. And in fact, a lot of patients are also realizing, they stay at ReGen for after stroke, maybe they stay 2 weeks to a month. That's more costly. But when you say cost, what are we comparing it? Actually, we are very, very much lower cost compared to operating at an acute hospital. Because we are post-acute hospital setting, there are a lot of services this hospital don't need. For example, we don't need a high-end operating theater. We don't need high-end imaging equipment. So we're able to operate at a much lower cost. However, to a patient, because it's a longer stay, so the total cost may seem a bit higher, but it is worth it because you stay a month at our hospital, but you get back your functional improvement and you can get back to your daily activities of daily living where you can live a quality life. You don't need to hire a maid or a helper or a nurse full-time, throughout the days. So overall, the cost is very affordable. In fact, if you look at a treatment at ReGen Rehab Hospital compared to an acute hospital, we're easily 30% cheaper.
Okay.
Stay.
Could you give us some sort of guidance in terms of your multidisciplinary approach to rehabilitative care?
Sure. Our multidisciplinary approach is more because it's going to be designed and all patients will be admitted to the hospital through a rehab physician. He or she will design a rehabilitation plan together with the patient and the family, as well as with the nurses and the therapists. And with this approach, then they will map out what are the functional limitations the patient had impacted after the injury, be it a sports injury, be it a stroke, be it a heart episode, how they can then come back to full recovery. Okay. So there will be a very intense planning of goal setting. What are the things that they need to achieve week 1, week 2, week 3, week 4, for example, if they need to stay for a week. Then, of course, together, they also worked out together with the pharmacist, with the dietitian, with the whole team to plan out the recovery goals, what are the therapy they need, and how we can do goal setting week by week, and overall the whole episode of stay. And the doctors then will always meet back with the team, the clinical team, to chart and track patients' progress. And if the patient is not meeting the plan goals, then how can they tweak to ensure patients are back and able to, catch up? So the end game is to make sure the progress is being tracked and monitored, and how the team work together to get the patients back up in their recovery.
Now, I want to take a different view now and talk about your facility and the business itself, because you are literally first of its kind in terms of your dedicated hospital. You were, and your key shareholders are Khazanah and Select Medical from the US. Could you tell us a little bit more about this partnership and what the strategy is?
Okay, how the strategy is, it started with Khazanah looking at this space, post-acute, something very new in this region, the Asia, Southeast Asia region, and felt that, you know, when we're looking at the mega trends of the population, we know that Malaysia will enter into an age nation in 2030. So we felt that this post-acute rehabilitation is so much needed. This service is so much needed compared to the Western countries such as the Europeans, the Americans, or even the Australian. So since this is something very new in the country, so Khazanah have looked at the different partner to see how we can bring such a service to the nation. So Select Medical, checks all the right box, and they came in and to provide that clinical protocol, the thought process, more the clinical aspect of it. So we work together to start this hospital. So the contribution for financial comes from both shareholder, but a lot of the clinical input comes from Select Medical.
I see. Now, you talked about key trends in Malaysia being an aging population by 2030. What do you see, and perhaps you can share a little bit more detail, are the needs for Malaysia, that there are gaps in the market which you and your shareholders will then hope to fulfill?
Yeah, there are actually lots of gaps because right now in the acute hospital, their turnover of beds are quite fast. The patient don't stay too long. And patient who need post-acute rehab needs a little bit more time. So their stay is after the acute episode, they would stay, say, 7 days to even a month or two. So that is a service that is not able to meet adequately both in the private hospital as well as in the public hospital because they are taking care of more, their bed space are very important and they need to focus on people who are on urgent care basis. So we are post-acute, so not as urgent. So hence we meet that needs. Right now, unfortunately, because we are first in the market, so a lot of people don't know about ReGen Rehab Hospital and they can't even envision much what is a post-acute rehab hospital would be. When we go to the market, people tend to compare this, in terms of pricing, in terms of service to a nursing home. But when they come and visit this hospital, when they see what we provide and what we do, from the doctors to the nurses to the therapists to the whole team, then they realize, okay, they understand the cost structure.
Yeah, and also because you have first mover advantage, so to speak, in terms of a dedicated facility like this, there's going to be a period of education that the market needs to go through before there is awareness and then acceptance also of it among the mass population.
Yes.
So can I ask you, in terms of medical rehab and stuff, what are the key breakthroughs and technologies that we could watch out for globally? Because after all, this is not a new concept, rehabilitation in the West. As you said, 30 years ago, people were doing it. In Malaysia, it is a new concept. But because we are late in the game, I'm sure that there are lots of things that you are doing which basically allows a leapfrog. Could you perhaps share what some of the interesting things that you've done which allows this leapfrog to happen?
Okay, what we are proud to have is we have two dedicated rehab physicians. One of our chief medical officer, Dr. Lydia, she was trained in Harvard Spalding, and she was trained in Australia. She was formerly head of rehab medicine in PPUM. So she has brought in a lot of clinical know-how in her training from the Western country back to Malaysia. And so besides that, the different use of equipment, for example, the transcranial direct stimulation for people who had a stroke, how they stimulate the brain. And we also use robotic, like exoskeletal, the robotic walk, So people who have spinal cord injury, lower limb not walking properly, they have injuries and severe injury. So we use all those robotic equipment to help patient to recover and also to exercise some of their weakened limbs. Yeah, so all this clinical protocols, equipment, all these are very new, and because we are a rehab hospital, we are able to focus, and this become the main offering of ReGen Rehab, besides the nursing and the therapies. And that focus is very different from the acute hospital.
So, Sue, a final question. What's the strategy for ReGen Rehab moving forward? And especially for your two large shareholders, because after all, you are early to market, you're first to market, and there's a very big opportunity, not only in Malaysia, but throughout the region.
Yeah, one of the opportunity is for us to grow awareness, as what you have rightly said. Building awareness is so important. We are constantly out there to build awareness and also to educate the public and also to educate healthcare people and telling doctors, you know, what we have done, how their patients have recovered so well, and so that they can continue to send their patients over to us so that this patient can be independent and get the functional skills back. So the key is awareness and education, educating the public and healthcare workers.
Now, Sue, it's been a pleasure and it's been fascinating speaking to you.
Thank you.
Now, I'm Brian Fernandez, and I've been speaking to ReGen Group's CEO, Tsui, on BizTech's Health and Wellness Show. This video will be on our Facebook and LinkedIn sites, as well as our website, www.biztech.asia. Please subscribe and like our Facebook and LinkedIn pages. Thank you very much for tuning in.